Hi, my name is Sundberg, and for my researcher profile project, I did a review on Mark Sundberg. Mark Sundberg has been a behavior therapist in the field for over 40 years. He received his Applied Behavior Analysis doctorate degree from Western Michigan University in 1980 under the direction of Dr. Jack Michael. The picture at the top is Dr. Sundberg, and the picture below is Dr. Jack Michael, who is well known for his application and advancement of verbal behavior. And Dr. Sundberg has been a licensed psychologist for over 40 years and continues to provide consultations to public and private schools for children with autism. Dr. Sundberg has received many awards for his accomplishments, specifically in verbal behavior. He is the founder of Analysis of Verbal Behavioral Journal. He's part of the board of directors for ABAI and also has been in the past for P.F. Skinner Foundation. He also received the Jack Michael Outstanding Contributions in Verbal Behavior Award from the ABAI Verbal Behavior Special Interest Group. He has made many publications, over 50 professional journal articles, and 4 book chapters, which one can be found in our textbook. He has also co-authored ABLLS and Teaching Language to Children with Autism or Other Developmental Disabilities, and he is well known for the Verbal Behavioral Milestones Assessment and Placement Program. Verbal behavior is his primary contribution to research and practice in the field. Dr. Sundberg claims that the primary focus of intervention programming for children with autism is the development of effective language skills. In the areas of research that I have reported in my research profile paper include his etiology of autism, as well as the importance of Skinner's verbal behavior publication to the field, the value of verbal behavior for children with autism, and verbal behavior implications between children with autism and children with typical development. So, as we all know, that one of the most well-known symptoms of autism is verbal and social development, impaired verbal and social development. And as we read the many literature and news articles that are coming out, there's a lot of people are skeptical about what are the actual causes of autism. And Dr. Sundberg focuses on genetic causes, environmental effects on the pregnant mother and child, and the social and learning environment. And while the primary intervention for treating autism, or early intervention as we say, is in manipulation through the environment, research in the areas of environmental contingencies is not as well researched as the areas focused on genetics. So, therefore, research should not neglect all factors as they continue to determine a definite cause of autism, whether it be a genetic or environmental factor. In regards to Skinner's publication of verbal behavior, there still are many challenges to face with verbal behavior. Dr. Sundberg notes how there's been an increase in empirical research, verbal behavior courses in universities as application programs, so schools that are based on verbal behavior, the piece of literature, and also an increase in verbal behavior presentations at conferences, and an increase of SIGs, special interest groups, specifically the Verbal Behavior Special Interest Group with ABAI, and recognitions from other disciplines such as linguistics, which provide other professionals an outlook of the importance of understanding verbal behavior and its effect on human behavior. Although there's been such great advancement, there still is room for more advancement, which includes verbal behavior recognition and behavior analysis. Also an increase in verbal behavior in textbooks as well as college courses specifically designed for verbal behavior. It's a very complex topic, and there is actually a lack of professionals who are specialized in verbal behavior and can actually teach a class geared towards verbal behavior. And with this limitation, there will possibly be seen a decrease in verbal behavior in behavior analysis. And also the verbal behavior needs to be incorporated into applied and basic research such as language assessment, language disorders, and behavior problems. In a recent study completed by Mark Sundberg and Cindy Sundberg of interverbal behavior and verbal conditional discrimination between children with autism and children of typical development, it was determined that children with autism and children with typical development exhibited similar difficulty with complex verbal stimuli. The verbal stimuli that was included was transitioned from simple verbal stimulus controlled to verbal conditional discriminations, WH questions, who, what, where, use of more complex parts of speech such as adverbs and adjectives, use of complex concepts, time, negation, and use of complex vocabulary. Based on this intraverbal assessment, the impairment of the child did not affect the level of performance as children with autism and children of typical development did achieve similar. In teaching children with autism verbal operants, Sundberg emphasized Skinner's use of elementary verbal operants and speaker and listener roles as important general contributors. He also emphasized the importance of language assessment in which an understanding of the child's command repertoire is gathered. This provides an understanding of the child's strength of dichotic repertoire, which can cause problems in other verbal interactions, and the child has control over social situations through me. Additionally, although having an extensive vocabulary, children with autism's intraverbal repertoires are impaired, so therefore it is important to ensure that the child receives direct interverbal behavior, so direct teaching of interverbal behavior. In a study completed by Sundberg of a 4-year-old and a 5-year-old with diagnosed with autism and limited verbal behavior and language, they noted how there wasn't much of a change when utilizing a intraverbal condition and the standard condition. It was very minimal with intraverbal condition and not much change with standard. They utilized 4 objects, and between 5 phases they switched from having 2 objects be taught through standard condition, and then the other 2 taught through interverbal, and then from there they would switch it. These are examples of my interview questions. I'm still waiting to schedule a interview phone call with Dr. Sundberg as he is headed to Chicago. Implications of his work really focus on the functional communication techniques, so it's understanding more than the definition of the word, but the function of the word. So when you tell a child phone, it's more than what the object is, but what it does. And verbal operants are beneficial for both the speaker and listener. And my conclusion, Dr. Sundberg really works with the advancement of verbal behavior and the recognition of how important it is with human behavior and understanding, language acquisition, and as well as success in academia for the child to be a successful contributor to society. And here is my bibliography. Thank you for watching this presentation on Dr. Sundberg.